Hello and welcome to Dr. Nora. In today's episode, I thought I'd give you an exclusive tour of one of the medical centres. Wait, it's not just a medical centre, but it's also a dental centre over here on the Gold Coast. Runaway Medical and Dental. Let's get inside and see what it has to offer. So first up on the right, you'll be greeted to the treatment room, which when you come inside, you will see that it has two very spacious beds. It has an area where lots of procedures take place, and for an example, today I did 3 skin excisions right here, removing skin cancers. So we do a lot of skin cancer treatment over here. But not only that, but we also attend for lots of wounds. For example, if you have got a wound on your leg, or if you're a diabetic person, you may need to have your blood test taken, and we have the facilities to do that over here. And on this side, you will notice that there is a laptop for when you need to write up those notes, and a telephone for when you need to call up reception. Hello, next patient please. Yes, I'm waiting. And then over here you have a beautiful benchtop which has got and then over here you have a beautiful benchtop which is filled with sharp bins, which is where we put our needles once we have used them. And you'll also notice the big mammoth of a machine here. What is that? Well, I will tell you, it is a PRP machine which essentially centrifuges all of the blood around so that they can extract all that beautiful plasma and inject it back into, say, your joint to help you with conditions like, for example, osteoarthritis of the knee or of the elbow. Moving on from there, we can see that we have 2 sinks. Now, you might be thinking, why is this sink called a dirty sink? It looks pretty clean to me. Well, actually, the dirty sink is where we put all of our instruments once we've used them after our skin procedures. And they go here, they get washed, and they're ready for sterilization. And once they're sterilized, they're inside these areas here, which are nicely marked out, and they say, for example, what they are, whether it's a forceps or whether it's a curette, and we can just take those open and then we can use them when we're doing our procedures. Well, Dr. Nora, you said that there were 2 sinks. One was dirty, so the other must be clean. We wash our hands over here and the dirty instruments over there. Right behind me here is the fridge. Now this is where we keep all of our vaccinations present for you guys. So when you come in, when you have your vaccines, whether it's your childhood vaccinations or even if you're adult vaccinations as well, we keep it all in the fridge. Right, let's check out the GP's room. Welcome to the GP's room. So this is just one of the clinic rooms that we have available in the practice. And as you'll see, it's got some beautiful chairs. It's got a really nice setup here. My patients come down, they sit here, sit in these really comfy chairs and tell me all of their problems. It might be that they need a simple blood pressure check, or even they may just need a tissue to cry on. Or perhaps you're in need of your pap smear and you know you haven't done that in a long time. So we simply ask you to come behind the curtain and get ready. Once you've had your pap smear, it might be time for a skin check, and in which case we might have noticed that you have some lesions that need a little bit of freezing, and for that we will use our cryotherapy machine, which is this thing over here, and we spray off any warts, any moles that we just think look a little bit suspicious. And naturally, of course, it's really important that for any doctor out there, we have to maintain our hand hygiene. And over here, we've got a sink that we use between patients to make sure that we're keeping hygienic. Now it's time for lunch. Now, for those of you out there that think that doctors and GPs and nurses don't need a break, well, we certainly do. Having a break is really important for our mental health, our energy levels, to make sure that we're providing you with exactly the right treatment that you need. And for this, we have a wonderfully equipped staff room, which is right behind you there. And for those lunchtime meetings, we all gather around here and we have a chat about the latest topics. For example, yesterday we spoke about sugar and how bad it is for the health. And we've even decided that we're going to do lunchtime talks with the practice, with the nurse, the dentist, the doctor. How amazing would that be? Let me know in the comment section below if you guys think that's a good idea. Now you might be thinking, Dr. Nora, where is your food? There is no food on the table. Well, do not fear, because this practice is wonderfully equipped. We have got a cupboard which has got all of our teacups in it and our lovely tea bags, and even there's a biscuit tray as well. Naughty, 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 I know what you're thinking. But more so, we have a fridge that has got all of our equipment. For example, our milk. Everyone needs some milk. All right, now that lunch break is over, it's time to get back to work. Now, one of the unique aspects to this medical centre is that it also has a denture lab. That's right, you can get your teeth done here. But there's also an in-house dentist. Let's go and meet her.
Hi Nora, how are you?
I'm good, thanks.
How's your day still so far?
It's been fantastic. I really can't wait to have my teeth checked.
Oh, really?
Thanks so much, Dr. Nidhi. My teeth feel so clean.
That's nice.
Thank you.
I can help you out today. I'm really very happy, Nora. And
Thank
we really are blessed that you are here with us.
Thank you so much. Now, Dr. Nidhi, it's time for your health check. Let's go into my room and ask you some questions.
Oh, absolutely.
Let's do it. Dr. Nidhi, what you have done in this practice is truly amazing. How did you come up with the concept of having a medical centre and a dental clinic all together?
Actually, it's not only my idea, it's a combination of me and my husband both. So I was in Melbourne before, and then I came here, and then I got married here, and then when I moved here, I asked my husband, okay, I'll join some practice and start working there. And he said, why you wanted to go there? Just see if you can do something. And then this opportunity comes up, and I was really very confused. Do I take it or do I not take it? Because it needs a lot of resources needs to be put on it. And moreover, it's a huge responsibility to take in. And being so young, when I've just started my family, it's just been too tough for me, where I'm thinking like I should allocate that time to my husband, to my family, or to my business. But then I thought, okay, this is the right time to get it done. Why not? Let's take this challenge, because I love challenges. So I thought, like, let's take a challenge and see if it comes out to be good. And to be honest with you, Nora, I'm really very blessed. People come and they join us, and whosoever people join us, they are lovely. I do have a lovely staff, lovely doctor, and then you joined us, which is just like a cherry on the cake. So what else we want?
It is such an enjoyable place to work, I have to say. It's
Absolutely.
Really nice practice to work in. The facilities are great. And actually, one interesting fact I'm going to tell everyone, because you are an absolutely inspirational lady, I have to say. We haven't even got into it just yet.
Thank you.
But you guys, Dr. Nidhi actually painted the whole of this surgery by herself.
Oh, that's a huge thing to do that. I told my husband, let's hire a thing. And he said, no, you don't have any work to do. Why not you doing it? I said, okay.
It's great.
It's not true. I thought like, okay, this is like kind of first baby to me.
Yeah.
And I just wanted to nurture this one, and I just wanted to give my personal effect to each and every place. So
you can tell.
Let's do it by myself. Let's do it a bit in pieces by myself, so that when I see this practice grow, I know that, okay, I have done a lot about it.
Well done, you. And I can see it growing, because it is growing day by day. You're getting more general practitioners, you're getting more dentists here.
Absolutely.
And how do you balance the life of like home life, practice manager, dentistry, wife? How do you manage?
To be honest with you, it's been very difficult. Yes, when I started this practice, I tried to do everything by myself, and I've just been in the practice from 8 o'clock in the morning till 7 o'clock, sometimes 7:30 in the night time, and then I go back home, cook food for my husband, and like he cooks food for me as well over the weekend. But I actually love, as I've told you earlier as well, I love challenges, and I've told you before as well, this is my first baby. So I thought, okay, let's do that, let's take this challenge. And then yes, it's been very difficult in the initial days, but as I've told you, like people come and they just start joining us, and I have got a lovely team, and slowly with their help, I'm building it up. Now I'm a little bit on ease, because I know I have people whom I can rely on it.
That's fantastic. Trust is really important.
Absolutely.
It's so important. And you mentioned about the patients. Now I have to say, Nidhi, from all the patients that I see, they come out, they're always really happy. They always want to come back and rebook. How have you managed to kind of create that nice ambience where the patients feel cared for and they feel like they want to come back? Because that's quite hard to keep a patient in a practice.
Look, our medical center logo is we nurture healthy lifestyles. That's our major motto. And as being a health professional by myself, I know I need to be very empathetic towards the patients. So I always give my personal empathy to all the patients. Whenever some patient go outside, I always go to them, ask them how you are you okay, and everything. And you know, when people are very sick and they come to the practice and they really wanted to have someone who can hold their hands and who can tell them that, okay, you are in the right hand. Yeah. And when people can have such kind of confidence and trust, then definitely they will come back to you. This is my, I think, so motto from the day one of my life, whenever I started practicing by myself. So I just keep this thing in my life as on, like, you know, going on. So I think so this will help me a lot.
Yeah, it's amazing. It's truly amazing. And aside from kind of the work balance, what do you do in your spare time to help you? Because obviously it can be quite stressful being a manager. And what kind of hobbies do you have?
Oh, I love cooking.
You love cooking? I sense that.
I love cooking. I always try to cook some new dishes over the weekend. Then I love reading. If I'm free, then definitely you can see me on my bed with the bedside lamp on and my husband is snoozing at the side of me and I'm just reading my book.
Fantastic.
And I love gardening. So
amazing.
These are three of
gardening
my hobbies.
as well.
Yeah.
What kind of things are you growing in your garden?
Oh, you have to come to my house. I have grown a lot of things.
Really?
Like chilies and capsicum, pumpkin.
Wow. Oh my gosh.
Lemons. Oh, I
love pumpkins, by the way. You guys can check out that video about the pumpkin pie.
Absolutely. In fact, me and Nora are having a lot of conversation about pumpkin.
We certainly have. We're going to do like a dentist doctor cook-off.
Absolutely.
We're going to get together and we're going to cook.
Oh, yes.
Healthy version.
Oh, yes. I think so we can cook some healthy
that'd be awesome.
dishes for that.
That'd be awesome. Do you know what, Dr. Nidhi, there's one question that I really want to know. You've got a small child. You're a dentist. The small child has just gone through dental procedure. What do? Do you give them a sweet or do you give them a sticker?
Oh, better to give him sticker.
A sticker. There you go. There you go.
No sweet.
No sweet.
Like kids come to us and they ask us, can you please give us lolly? I said, no, sweetheart, we can't give you the lollies. Otherwise,
So you're firm.
we'll be in trouble.
I love that. And then finally, from a dental side of things, how often, what's your recommendation for your dental hygiene? What do you recommend to all of our viewers out there who haven't seen their dentist in a while?
Look, my recommendation to all of the lovely people who are seeing this video, I really want you to go to your dentist after every 6 months, get your teeth checked. Don't get afraid. You have lovely dentists all over this Gold Coast. I'm not saying that come to me, come to any of the dentists wherever you go, but just go and get your teeth checked. Because if your teeth are in good shape, then you can eat good food and then you will be healthy. That's
Very nice. I love it. So every 6 months, you know what? I would come to this dentist, to be honest.
Oh, I would love to have such a gorgeous doctor on my chair.
I was on your chair.
Oh, yes.
I love it. Dr. Nidhi, you're a true inspiration to everyone out there.
Thank you, Nora,
really
for
what
having
you have
me
built
there.
together and everything that you brought this practice up from pretty much, from ground zero. You've now got bustling with patients. You're seeing beautiful patients here. Great practice staff as well, very well supported. So congratulations.
Thank you.
Onwards and upwards for your success.
Thank you.
And guys, if you have any questions for Dr. Nidhi, please don't hesitate to drop us a line in the comment section below. I'm pretty sure we're going to do some more together.
Absolutely.
100%. And of course,
More videos to come.
definitely more videos to come. Do you guys want that? We can do like dental checkups. We can do
yes.
health checkups. That'd be awesome. Get me on the chair and we can do something to my
yes.
teeth. I don't know
Absolutely.
what. Whitening or fillings or maybe not that.
Yeah.
And of course, guys, I hope you've enjoyed watching this very informative episode with Dr. Nidhi and myself and the practice here at Runaway Bay Medical and Dental Centre. And if you'd like to book in, please find a link in the comment section below. But for now, take care and stay healthy. I really can't wait to have my teeth checked. And for those lunchtime meetings, we all gather around here, and we have a chat about the latest topics. For example, yesterday we spoke about